Well, COVID-19 is taking a deadly toll, specifically on black communities in Chicago and other cities across the country. Why is that? We're going to speak with the director of the Illinois Medical District right after this. As we said there in Chicago, black Americans are dying from this virus at a higher rate than any other racial demographic. 68% of the city's deaths are among African Americans, yet they only make up about 30% of the city's total population. Joining me now to discuss, Dr. Suzet McKinney. She's the CEO and Executive Director of the Illinois Medical District. Thanks so much, Doctor, for taking the time this morning. You know, we've talked a little bit about the causes of this, health reasons, but also socioeconomic reasons. A lot of black Americans, they can't work from home. They have to still show up on the job and, of course, expose themselves to this. I wonder, how do you get around that? What can the city do to help, or is there a way to help?
Well, you know, first of all, thank you so much, Jim, for having me today, and thank you to Poppy as well. I think one of the things that I'd like to highlight, first and foremost, you know, we know that this is a problem here in Chicago. Our Mayor Lori Lightfoot, as well as our Governor J.B. Pritzker, have been working diligently to address these disparities. But, you know, there are so many social determinants of health that play into this. And we keep hearing messages all across the country about staying home and staying safe. And that really is the key to helping us curb this situation right now in the absence of a medical countermeasure to treat it.
So if staying home is the secret, what do you do for folks who can't earn a paycheck if they stay home?
You know, I think that speaks to one of the most difficult challenges that we are seeing with this situation. And that's why our mayor, once again, Mayor Lori Lightfoot, has released a program that will provide financial assistance to those here in our city who are unable to earn a paycheck throughout this crisis because of the need to shelter in place and stay home. However, you know, I can't say that that's a be-all to end-all solution, but it is certainly something that can and will help.
I hear you. I mean, all these things are ways to help fill the gap, but impossible to entirely fill the gap. President Trump, he was asked about this in the press briefing yesterday, and he said, we're doing everything in our power to address this challenge, speaking of black communities facing this. You mentioned the help you're getting from the mayor there. Is the city of Chicago getting help from the federal government to address this?
Well, you know, I don't want to get into any, political turmoil with this question, but, you know, I think that we are working very closely with our federal partners. We are getting quite a bit of assistance from the Army Corps of Engineers, as well as our National Guard partners, to assist us in establishing alternate care sites for treating those that are impacted by COVID-19. And I think, you know, both, again, our city and our state are working very diligently under the leadership of Mayor Lightfoot and Governor Pritzker to do all that we can to ensure that not only do we manage the current situation with the pandemic, but that our local and state economies recover as well.
Different cities are moving at different paces here in terms of infection and are hitting that kind of peak at different times. And Chicago's experience behind that of, say, New York. Tell us what the situation is on the ground now. What do you think when you hear people, including the president, already begin to talk about lifting some of these social distancing restrictions, perhaps after the end of this month?
Well, you know, one of the things as a public health professional that I always try to remind people is that COVID-19 is a novel virus, which means it's something that we haven't seen before. You know, there's no medical countermeasure to treat it. And so social distancing and other community mitigation measures are the critical strategies, really the only ones that we have to curb this. I think we heard Dr. Fauci say just a couple of weeks ago that it is the disease and its behavior that's going to determine when we can begin to limit some of those social distancing measures. And so I really believe that as a public health professional.
Yeah, I remember his phrase, Dr. Fauci, that the virus sets the timeline, not anybody else. Dr. Suzet McKinney, thanks so much for the work you're doing.
Thank you so much.